Hi guys, my name is Jason, and my exposure it is Ivabradine of catecholamine induced tachycardias in patients with paraganglioma. We have definitions, applications in medicine, pros and cons, usage applied in Ecuador, and conclusion. We're going to continue in definitions. Paraganglioma is a type of the neuroendocrine tumor that forms near certain blood vessels and nerves outside of the adrenal gland. And I have this video of tumors paraganglioma.
Is a rare, slow-growing neuroendocrine tumor that occurs in every gender, race, and age.
Just one more time.
Paraganglioma, or para, is a rare, slow-growing neuroendocrine tumor that occurs in every gender, race, and age. Paras develop along the parasympathetic or sympathetic nervous system and produce too much catecholamines, which is a hormone that prepares the body for fight or flight reactions. Symptoms can include high blood pressure, anxiety, heart palpitations, sweating, headaches, and many more. Although it is rare, some paragangliomas do not produce any catecholamines, so symptoms may not appear. These are known as non-secreting tumors. Distinguishing para from other conditions can be a challenge. For secreting tumors, the 24-hour urine and blood plasma tests are the first step in receiving a diagnosis. A CT, MRI, or functional imaging can also help identify where, how many, and size of the tumors. Everyone diagnosed should talk to their doctor about genetic testing, because approximately 35% of diagnosed PHIOs and paras are the result of a genetic mutation, which can be passed down through children. Surgery to remove the tumor is the most common treatment. Before surgery, the patient must be blocked with medication to avoid a hypertensive crisis from a massive release of catecholamines during surgery. Non-surgical treatment options are available and listed here. Approximately 20% of cases are metastatic, which means it has spread to other parts of the body, but treatment options are available. Because para is rare, it is important to see an experienced medical team. All of this information can be overwhelming and scary. We are here for you throughout your journey, because together we are PHIO Para Fearless.
We are going to continue with what is tachycardia. Tachycardia is a condition that makes your heart beat more than 100 times per minute. I have one video for this explain tachycardia. Is this video? Please see it.
Tachycardia refers to any time the heart rate is above 100 beats per minute. Tachycardia usually presents as patients feeling their heart and thumping of the heart. Normally, you're not able to feel your heart pump. Anytime you feel your heart beating faster, that's referred to as tachycardia. If usually the rate is above 100 beats per minute. Patients usually feel palpitations. Depending on the nature of tachycardia, it could be regular, where the people feel their heart pounding regularly, or it could be irregular, where it presents like that. The irregular tachycardia usually suggests underlying atrial fibrillation. Regular tachycardias could be supraventricular tachycardia, or sometimes even from bottom chamber of the heart, referred to as ventricular tachycardia.
I like this video. It's very informative, and we're going to continue. Ivabradine. What is ivabradine? It's in a class of medicine called cyclic nucleotide, or HCN. It works by slowing the heart rate so that the heart can pump more blood around the body each time it beats. this is the last video for Ivabradine, and it's very informative. Please pay attention.
Personalized health companion. In this video, we are going to discuss about Ivabradine 5mg tablet. We will be discussing elements like why it is used, to whom it is prescribed, its consumption, and various side effects. Before starting with the theory, let me tell you a brief about this medication. Ivabradine 5mg tablet is a cardiotonic agent that works on the ionic current, which results in slowing down the heart rate and increasing blood flow. It is prescribed to patients who have suffered heart failure. The drug basically controls the condition and helps improve the state of the heart, thereby regulating heart's pacemaker current. This medication is prescribed during congestive heart failure and chronic stable angina. Some of the common side effects of this medication include slow heart rate, abdominal pain, headache, and blurred vision. Pregnant and breastfeeding women are strictly advised to avoid the use of this medicine and look for an alternative with the help of a doctor. Children below the age of 18 years are not recommended this drug. Warning: please do not take this medication without consulting your physician.
We continue with applications in medicine. Ivabradine is a drug that exclusively reduces heart rate. Action by selective and specific inhibition of the cardiac pacemaker, the sinusal mode. And we have pros and cons. Um, the pros of this pharmaco, its cardiac effects are specific to the sinus node, with no effect on intra-atrial, atrioventricular, or intraventricular conduction time, nor on myocardial contractility or ventricular repolarization. It's the pros. And we have to continue with cons. In cons, the most important is the blurred vision, bradycardia, first degree atrioventricular block, ventricular extrasystole ventricular, atrial fibrillations, and under control blood pressure. It's very difficult to manage its form. Cons adverse. The cons adverse effects. The most important is blurred vision, bradycardia, first degree atrioventricular block, ventricular extrasystoles, atrial fibrillations, and under control blood pressure. It's very difficult to manage. It's very difficult this farming. We have to continue and should place it in Ecuador. According to the publication of the Ecuadorian Journal of Cardiology on 2021, it indicates in the following recommendations. Ivabradine is recommended to reduce the risk of the hospitalization for HF in patients symptomatics with a HF-REF it's minor of 13.5 with optional medical treatment with have your heart rate it's higher to 17 and BPM 55. It's all in we're talking about with Ivabradine in Ecuador. In conclusion, the Ivabradine has an excellent safety and benefit profile in patients with heart failure. It's all. Thanks for listening. Bye bye.